A new walk-in mental health clinic is coming to St. Joseph courtesy of the Family Guidance Center. Tonight's guest is Kristina Hannon, the co-CEO of Family Guidance Center. Charles.
Thank you for being here.
Yes,
Glad you're here today.
So
and we've got several things to talk about, but I know this new urgent care or behavioral health urgent care center is your next big thing. So talk about that for a minute.
Yeah, so our Behavioral Health Urgent Care Center will be hosting a community grand opening event on Friday, March 31st at 2 p.m. Everybody in the community is welcome to come to the event. You don't need to RSVP. You can just come to the clinic at that time. Our clinic is located at 4906 Frederick Avenue. We will start treating patients on Monday, April 3rd. Our clinic will open at 7 o'clock in the morning, and as of right now, it will be open 7 a.m. to 7 p.m. Monday through Friday, and then we will extend to a 6-day model with the goal of moving towards a 7-day model so that we can meet more community needs. And at this clinic, what we'll be doing is it is a true urgent care clinic. You do not have to be in crisis to walk in. You can just walk in if you're experiencing depression, anxiety, you're concerned your child may have ADHD, a teacher at school has suggested your child may need to be evaluated. If you're struggling with substance use, anything, just walk into our door and you will have access to a psychiatrist, a psychiatric nurse practitioner, caseworkers, nurses that will be able to assess and treat you and determine if you do need ongoing treatment.
Wow. Well, that's amazing, and we've talked about the great mental health needs in rural areas across the state, including our area. Talk about then how does that process work? How would someone just walk in, and how, like in regard to insurance, payment, referrals, and all that? Talk about that for a second.
So that is one of the really unique things about this clinic is we will take everybody who presents. So no insurance, private insurance, Medicaid, Medicare, whatever your insurance status is, that does not dictate the care that you receive. So you will literally just walk in, you'll be greeted by a receptionist. The receptionist will get some basic demographic information. He or she will ask if you have an insurance card. We'll take a copy of it, but that should not prohibit you from accessing care. And so if you cannot afford to pay for care at this clinic, you will not pay for care at this clinic. We want to make sure that your care needs are met and that we route you to an appropriate provider in the community. One of the important things to know about this is that when you come in, you will be with us maybe, we're hoping to get everybody kind of in the door, back out the door within an hour, hour and a half. So we want you to come in, you'll see a nurse first. The nurse will do a basic set of vitals with you, and then we'll ask you some questions about what's been going on, why you walked in the door, kind of what you think your needs are. We'll do a quick assessment with you of what we think your needs are, and then we'll be able to route you to a psychiatrist or nurse practitioner to determine if you need medication and for a formal diagnostic evaluation. At that point, you'll have a choice as to what services you receive and where you get them. One of the big things with this clinic we want the community to know is this is not about Family Guidance Center becoming a solo provider. We are blessed to have so many good providers in our community. We have the center, which is up the street from where we are right now, Northwest Health Services, Mosaic Outpatient, De Novo Recovery. We have all of these places we want to refer you to, and we want to make sure you get where you need to go to get your healthcare needs met.
That's great, and all ages, and this has been about a 2-year process to get this going. Talk a little bit about how that process came about.
Sure. So this project has taken us about 2 years to bring to the forefront, and this really started with our legislature and with Governor Parson. And so we are lucky in the state of Missouri to have a legislature and a governor who really care about our people and about the mental health and behavioral health needs of our communities. And so Governor Parson put this project out there and asked that one of these centers be created in every city where we have a state highway patrol headquarters. And so that's really how this came to St. Joseph. And so we then took this on and had to identify property and a way to fund that. And so and staff, that was the biggest issue, and one of the delays is finding enough staff. So we are now fully staffed, and we are ready to welcome the community at our center on March 31st.
That's amazing. And speaking of staff, like every other industry, every other group, as a group, as the Family Guidance Center, not just that urgent care unit, but all of the services you provide, there are still staffing needs, right?
There are still staffing needs. Yes, that's one of the things that mental health, behavioral health, we're not immune from the workforce crisis that is going on in our community right now. And right now, Family Guidance Center has 37 openings for staff. These are openings for people who are nurses, who are licensed counselors, clinical clinical social workers, case managers, but most importantly, for anyone who's watching, we have positions available if you have no formal education, but if you're a person who's in recovery from mental illness or from addiction. And we can hire you as what's called a peer professional or a peer support provider. And so if you are in recovery, you have a valuable lived experience that can help promote other people entering recovery, and we are interested in talking with you. And you can go online to our website and apply for positions.
That's amazing. Well, so you have a wide range of,
Yes.
of needs and a wide range of potential folks in the area. Going back to something you said, Chris, earlier about the you didn't want this to simply be a FGC kind of thing. Talk about the way that nonprofits in the area, especially in regard to health and mental health, network together. What's been your experience with that?
Yeah,
as the
so
CEO?
I've been a social worker in St. Joseph now going on 23 years, and so having had the benefit of working here this long, I've been able to see the way that people partner together, and that's very different in this community than in most communities across our state. When I talk to people in my position in other areas of the state, they don't know who heads up their United Way, they don't know who runs their food centers, they don't know who runs their local shelter, they don't know who to talk to on the mental health unit. And so we are really fortunate to have solid leadership in our nonprofits and in our healthcare sector, that we all work together and try to partner to meet everybody's needs. And I think that's something that's unique about St. Joe. You know, the chamber advertises uncommon character, and I think that's one of the things that gets missed with St. Joseph in terms of our uncommon character, is just the willingness of our nonprofit community, our healthcare community, to partner together to help make our community better. And I think that is one of the most unique and most striking things about St. Joseph, and honestly, it's one of the reasons why I've been interested in continuing to work in this community.
Great. Well, and it's not uncommon, right, for a referral to come from any group, church or United Way or Catholic Charities or a wide number of places. Right?
Oh yeah, so we take referrals from all manner of social service agencies. I mean, the hospital is a great partner. Law enforcement, that's one thing that people don't talk enough about in our community in terms of behavioral health, is law enforcement really become de facto first responders. And so we've been fortunate to have really solid leadership within local law enforcement to partner with them, so that we can embed clinicians both in the jail and in St. Joe PD, so that we can have quick response time. And at our behavioral health urgent care, law enforcement will have an office that they can come and bring people into.
Great. And one final thing, and I hate to do this because this is such a big thing that everybody's excited about, but what's next? What's happening after this?
Yes,
so I know you got always have something going on.
Yes, what is happening next at Family Guidance Center is we'll be bringing up an adolescent substance use treatment program. We know that youth in our community are struggling with drug use. We used to see young people just using marijuana and alcohol. We know we have youth in our community because we're treating some of them that are using fentanyl, heroin, methamphetamine. And so we're developing programming to target adolescents who and their families who are using substance use, so that we can provide extra supports and interventions to hopefully help these youth have a much more positive outcome in their lives.
Great. Well, Kristina, Hannon, thank you so much for giving us that information. And folks did see on the screen the address of the new urgent care place, and it's opening March 31st. There it is again. And then you say beginning of April, you're hoping to be treating patients 6 and eventually 7 days a week.
Monday, April 3rd.
All right. Well, thanks for spending time with us today, and thank you for joining us for Community Conversations. We'll have more news after the break.